Colloids is interesting. And the reason I say that is because it's so specific as far as being a type of fluid in which strictly remains within the plasma compartment. And we've mentioned this earlier, and why is it that you don't want to give? It's not that you don't want to give, but what precludes or prevents you from giving this readily is because, once again, being cost-effective. This colloid, some of these, tend to be quite expensive, especially when you're dealing with albumin. So these are large proteins, colloids are, versus crystals. Crystalloids would be your electrolytes, which was our previous discussion. Well, colloids, these tend to be large proteins. Now, in the ECF, that membrane, known as the capillary membrane, is not permeable to protein, large protein, is it? Not at all. So the large protein remains within the vasculature. Thus, if need be, and you see any scenario in which the patient is receiving colloids, please understand it's only the plasma compartment that you are, in fact, filling. Now, in terms of it being effective, obviously, a lot more effective. Theoretically, it remains within the intravascular space. What does that mean to you? The plasma compartment for longer periods of time. Example here. Now, I do want to give you a clinical correlation for fresh frozen plasma, and we'll go ahead and call this cryoprecipitants as well. But now there's actually a fine difference between cryoprecipitants and fresh frozen plasma that I need to delineate. Because if you just read through this line here, this statement, you may or may not understand the significance of it. Albumin, straightforward. You want to replenish the vascular compartment, then you give albumin. Okay, fine. That's straightforward. Now, the fresh frozen plasma is interesting. What are you doing with fresh frozen plasma, and what are the indications of giving FFP? Fresh frozen plasma, or FFP, the indication, well, who is this patient? The patient comes in and, my goodness gracious, pretty much looks as close to death as a patient can get. And by that, I don't mean where the EKG has a V-fib, of course. I'm just saying, just straight up, a gross examination of your patient. Gross appearance, just bleeding from every orifice is what I'm getting at. Bleeding from the nose, bleeding from the mucous membrane, looks really, really just sickly. And, well, the labs have hardly been done. And on the labs, you find the following. You end up finding where the PT is prolonged, PTT is prolonged. You find that the bleeding time is prolonged, and you find the platelet count to be decreased. And that patient there, who looks as though they're bleeding from every orifice, and guaranteed, with those type of labs, your patient has what, please? Good. DIC, disseminated intravascular coagulopathy. But DIC, what is it that you might want to do to stop that bleeding? Fresh frozen plasma, because it contains what? Your coag factors or coagulation factors. Now, versus cryoprecipitant. Now, cryoprecipitant is a little bit more specific. Yes, it does contain some of your coagulation factors, but not all of them. Yeah, cryoprecipitants there include some of the ones that begin with the letter F. And these include fibrinogen, fibronectin, and it would actually be something like von Willebrand factor. So what this means to you is, well, what if you did have a patient who's a female, and whenever she was having her menstrual cycle, she was having pretty large amounts of bleeding taking place, menorrhagia. And along with this, the labs then show the following, where you find that the bleeding time is increased, and then you also find that the PTT is increased. With that type of history and those type of labs, where it's PTT and bleeding time elevated, would you tell me as to what the diagnosis of your female is here? Good. Von Willebrand disease. So with von Willebrand disease, you might be thinking about giving something like cryoprecipitants. Are you seeing now as to, fine, you find the categories, you're looking at the definition of what a colloid is, but then truly, I'm giving you perfect, well, I say perfect because I don't like saying that for the patient. The patient obviously is in great demise, great distress, but these are really excellent diagnoses in which the indication would be the particular colloid that I have highlighted here.